And you know, some people can't live without good eyesight. I know this. You know, there are some people that stumble in the morning. Now, I can't even imagine this. They can't see anything until they put their glasses on. I can't even imagine that. But many of you right now listening say, yeah, I know that. You know, you can do something about it. Okay? And I'll tell you what, we have someone here, Dr. John Dishler. No matter where you live in the state, you can see an eye doctor, okay, in your area, your favorite eye doctor, and still have the very best surgeon. It's a referral program. And what's cool is you get the best of both worlds. I sound like Miley Cyrus, but it's the best of both worlds, because we have a doc here from my neck of the woods in Parker, Michael Bell, near Parker at Venice, and Dr. John Dishler, our expert on LASIK. Explain this referral process. You explain. How do you work with Dr. Dishler?
Well, we see patients in our office. We're able to do the pre and post-operative evaluation. So basically we do the workup, determine their candidacy, and then if it's a good candidate as a patient, then we would send them to Dr. Dishler, who would then perform the surgery.
Now, there was a myth that eye doctors, optometrists, they don't want to refer because they lose a patient. They lose the eyeglasses. They lose that. How do you look at that?
I look at it, I want to do what's best for a patient.
And it's just a viable alternative.
Absolutely. I mean, I've had the surgery myself, so I know how life-changing that it can be. So, you know, a patient can just, it's remarkable. It can change their life. I do what's best for the patient. If that includes LASIK surgery, then everybody's happy.
And of course, not everyone's a candidate, right?
That's true.
Can you help determine that, or you consult with Dr. Dishler?
Absolutely, yeah. We work in direct connection with Dr. Dishler, determining candidates.
Have you ever thought maybe someone might not be, and Dr. Dishler says, yeah, I think we can do that?
Yeah.
Yeah, so it goes back and forth. Dr. Dishler, speaking about referrals, how important is it to you to have professionals refer people to you?
It's the key to our practice. This is how it works. I mean, almost all of our patients come from great guys, like Dr. Bell here.
I should mention that. People can come directly to you.
They come directly to us, but 80% of our patients or more, 85%, come through referrals. Michael and his wife, who's also a doctor, they're our go-to people for Parker. And they have a great practice. Their patients trust them. They can do an evaluation. They can give them an honest appraisal. Just like you said, is LASIK good for them? Are they better with contacts? Are they better with glasses? But for the people where they are good candidates, where it will be a good thing for them, then he refers them to us. We do some specialized testing. We call it one visit, is it? Because they've been worked up so thoroughly by the time they come in, they just can come in one time, have the procedure, and then after they're, a day or two later, they go back to his practice, and he takes care of them from then on. And it's just the way
that's a great partnership.
It's a great partnership, and it's the way medical care of the future is going, because it's very efficient. They don't have to pay for having us do things that we don't need to do, and they get to keep their regular doctor. It's just been a wonderful situation, and it's the way we've done things. And in fact, Dr. Bell himself
2007 you had?
Yeah, he had LASIK
going
himself.
On 3 years now.
He was just telling me while we were waiting to come on how he just was skiing up Copper Mountain, and how enjoyable it was to be able to ski without, needing his glasses, his contacts.
What was your sight like before?
Well, I was one of those people who really couldn't function without glasses or contacts. Things like waking in the
fumbled around.
Absolutely. Waking up in the morning, not seeing an alarm clock. Just daily activities.
And you were an eye doctor at the time.
Yes.
So you're thinking, I got to do something.
Absolutely.
How'd you find out about Dr. Dishler?
Well, I'd worked with Dr. Dishler, in the past, and so I knew his, his skill as a surgeon, his experience as a surgeon. And so to me, it was an easy choice.
Yeah, there's just no question. Dr. Dishler, I never asked you this before. Have you had LASIK?
No.
No.
No. But I would if I needed to, but I don't. I happen to have good vision.
You do. I mean,
I'm really lucky that way.
Because I see you at the office, and when you check me and you don't use any, well, how'd that happen? I mean, and so really, this is something that happens all over the country or the state when it comes. Have you had referring doctors outside the state?
Oh, absolutely.
Really?
A lot of patients come to us from Wyoming. I'd say 20-25% of our patients actually come from Wyoming. We have patients from Kansas, from Nebraska. We've had some from South Dakota, and actually a handful from even further away than that. Most of our patients come from Colorado, but all over Colorado, and it's really been a nice situation that patients can get the specialized care and then go back to the regular doctor.
You know, it's important. As I said, we love the referring docs, and they bring credibility to the practice, and they can take care of their patients. But if you don't have an eye doctor right now, you can go directly to Dr. John Dishler.
And what's more is if they come directly to us and they live in Parker, chances are we'll say, you know what, you've got a great doctor right down the street, and we'll work with them. So we do a lot of referring. It's a reciprocal situation.
It's a back and forth thing.
Absolutely.
The technology I want to talk about just a little without getting too technical, because people see these come-ons for very low prices and these come-ons, but the truth of correction and blade-free, what does it involve?
The current state-of-the-art, virtually the standard of care now is all blade-free LASIK. That's all we do. You know, there's a lot of centers that have various choices, menus, a low price entry thing, but if you really want the good stuff, you know, then it costs more, and that just doesn't make sense to us in the medical world. You want to give people the very best. So we just have one price, whether it's LASIK, PRK. We give everybody the very best treatment that we can.
I mean, if you're going to go through it, do it right. I mean,
right, and we try to price it as reasonably as we can. We're very competitive. That's why we guarantee it's the lowest.
It is.
For blade-free custom LASIK, you get the benefit of all of that. You get the benefit of working with other doctors.
And that's all care. So when you quote a price, it's not a nickel and dime situation.
It's everything. And you know what? For the rare 1 or 2% of people where they don't get completely corrected and we have to do a little bit more, we do it at no charge.
Here it is, lowest guaranteed price. Custom bladeless LASIK. No matter what correction you need, it's covered. So they're not going to come back and say, well, if you need this or that. 0% interest financing is really good. 0% financing. And that's for 24 months. So it's basically free financing for 24 months at the guaranteed lowest price. That's all good. And this is available through affiliates as well, right? When they go to an affiliate, they can get this financing situation.
Same price, no matter how they come to us. There's no difference.
Now, I should mention that, and after this we'll mention, you were named as one of the top 10 in the country by an independent rating group that appeared in Forbes magazine. But here's the contact information: 303-793-3000, 303-793-3000. Dishler.com. Here's something I'm proud of. I'm a good referral. I'll tell you, because I know people watch and might call you without talking to me, but you wouldn't believe there's a Forbes magazine article there, and this was an independent testing group, or rating group, I should say. And you don't pay to be on there. So I want to mention, you don't know how many people that email me personally or call me and say, what's the story? I don't know why. I don't know why they think I'm going to say something different, you know, because you've been on the show and I say he's great. And then they call and say, so what do you think?
What's the inside story?
So I'm a referral too.
Well, thank you.
All right.